Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loweyball, and this week we're talking about the link between inflammation, kidney disease, and cardiovascular disease. Is inflammation the fire that fuels kidney and heart disease? Inflammation is the body's normal response to injury, infection, or harmful stimuli aiming to protect and heal tissues. It's like a campfire on a cool night. Great for warmth, perfect for s'mores, and oddly hypnotic to stare at, until it decides to roast more than just marshmallows. When comparing inflammation and fire, the name, usefulness, and potential danger all bear a striking resemblance, and if you're not careful, both could end up torching your tissues. Let's try to shine a light on inflammation and how it might be the link between kidney disease and heart disease. The kidneys are a pair of organs that filter our blood. When this filtration slows down or fails, we may have chronic kidney disease, a condition that affects over 850 million people worldwide. Chronic kidney disease is classified according to a combination of the filtration rate and the amount of albumin, a protein, found in the urine. Lower filtration rates and more albumin indicate a higher risk of chronic kidney disease. This can be fatal on its own, but the cardiovascular system actually fails before the kidneys in most patients. Research shows that chronic kidney disease is associated with increased risks of coronary artery disease, heart failure, high blood pressure, and sudden cardiac death. But why? Scientists think the link between kidney and cardiovascular disease may be inflammation. An acute inflammatory response helps protect us during trauma or infection, but chronic lingering inflammation is a slow burn that can ultimately lead to widespread damage. The kidneys influence inflammation in large part because they don't just filter, they detect. The kidneys remove waste products, balance nutrients, help regulate blood pressure, and respond to things like dead cells. When the kidneys detect an imbalance in the system, they release proteins like hormones, cytokines, and enzymes. Hormones are chemical signal molecules, cytokines are immune regulatory proteins, and enzymes speed up chemical processes. These circulate through the bloodstream and help the body fend off whatever danger is present. In chronic kidney disease, however, the system breaks down. When the kidneys aren't functioning properly, they may mistakenly release proteins or release them in excess. Unfortunately, this fire burns at both ends because chronic inflammation is a major driver of kidney dysfunction. Kidneys and inflammation systems can undergo physical changes to cells or tissues that result in more hormone and cytokine release, more sensitivity to hormones and cytokines, or both. This is where it gets even more dangerous. Chronic inflammation affects the heart and blood vessels, but so do the kidneys. Chronic kidney disease and chronic inflammation can both raise blood pressure and increase the risk of atherosclerosis, plaques that harden the arteries. And jumping from the frying pan to the fire, high blood pressure can damage the kidneys. So what can be done? The first and most obvious things to target have clear solutions and quick effects, like quitting smoking and lowering high blood pressure. Unfortunately, the links between chronic kidney disease and cardiovascular disease aren't always managed properly. In fact, a 2015 research article found that patients with acute coronary syndrome and chronic kidney disease were actually less likely to receive evidence-based therapies. This is in spite of several medications that have been shown to improve outcomes for these patients, including anti-inflammatory medications, statins, beta blockers, ACE inhibitors, and more. One systemic problem has been the lack of inclusion of chronic kidney disease patients in clinical trials that target cardiovascular diseases. However, this is starting to turn around, and clinical trials may be enrolling now that target this critical population. Let's turn up the heat on inflammation and chronic kidney disease to cook up some better solutions. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the Med Evidence podcast. My name is Benton, and we'll see you next week.